Then there are some European fillers. उनकी prices भी range करती हैं between 10 and 15, 16. जो जिनको बल्कि कहते हैं कि the Coca-Cola of fillers, that is Restylane. Restylane is 19,000 per ml और एक उसमें 22,000 per ml है. And और फिर इसी तरह Restylane or Juvederm is 22 to 23,000 per ml. एक उसमें आता है which is 33,000 per ml. ये दोनों वो fillers हैं कि जो celebrities और they want this. बाकी चीज़ों में it's good to start off with the Korean stuff. Now, in fillers we'll talk a little bit about classification क्योंकि ये बहुत vast subject है. Then we'll look at the indications, कहाँ पे आप लगा सकते हैं, कहाँ पे नहीं. We'll look at some contraindications, pre-operatively क्या करें और साथ में कुछ injection techniques जो हैं वो भी फिर आप देखेंगे. So first of all, qualities of an ideal filler. It should be non-allergic. अगर आपका filler allergic है, it can cause serious problems because filler already चला गया है body के अंदर. अब अगर उसने allergic reaction cause किया, this would be very severe. So you have to have a filler which is allergic now. Non-migratory. Non-migratory is again very important and it's a very common complication. If you have injected a filler in the nasolabial line, mostly line सबसे ज़्यादा ऊपर नहीं होगी. अगर आपके filler ने थोड़ा सा migrate करके वो नीचे आ गया, so your filler would become नस्वार. ऐसा लगेगा जैसे यहाँ वो पड़ा हुआ है. And then you will have to dissolve it. So you need to have a filler, and this is very common. Even last month, one very senior doctor, he had a problem और फिर उन्होंने मुझे picture WhatsApp की, and I asked him कि आपने इसके साथ क्या करना है. Long lasting, ये एक ऐसी चीज़ है which makes your consultation very difficult. क्योंकि patients को ये 6 महीने ऐसे लगते हैं कि बस हम मजाक कर रहे हैं, 6 महीने यूँ गुजरते हैं, जबकि वो 6 महीने ऐसे नहीं गुजरते. But during consultation, they keep on asking for longer lasting fillers, longer lasting. और हमारी कोशिश ये होती है कि I or any other doctor in the world, we would like to have shorter acting fillers. Shorter acting इसलिए because everything never goes according to the plan. Recently, just 2 weeks back, I was shown a picture of Katrina Kaif. She has recently done something. और वो patient ही मुझे वो picture और video दिखा के लाई कि इसने क्या किया हुआ. She looked terrible. अब this is where celebrities go wrong. They ask for longer acting. फिर हम plastic surgeons we give them an option of fat. Fat के साथ अगर हम filling करते हैं, that is very long lasting and can stay there for life. But if something goes wrong with fat, that also stays there for life. With fillers, if anything goes wrong, HA fillers, you have a solution for that. Within 24 hours, you can resolve that. इसी वजह से now, Katrina Kaif would be carrying that face because probably that's fat. अगर filler होता तो जिसने भी किया तो वो dissolve कर देगा. This is the problem with long-lasting word. So you always have to be very careful. When you are starting your clinical practice, always go for shorter acting HA filler जिसे आप easily dissolve कर सकें if it goes on. Pain-free injection, this is since it's a cosmetic procedure, so people don't want to have pain. इसलिए फिर वो चाहते हैं कि हमारे जो injections हों वो pain-free हैं. So you have to try one way or the other कि हम उसे थोड़ा सा pain-free करें. Normally fillers come in combination with xylocaine. 1 ml अगर filler है तो उसमें 0.1 ml xylocaine होता है. The तो जब आप इंजेक्ट करते हैं उसके साथ पीना हो जाता है। There are certain blocks that can be used, लेकिन टॉपिकल एनेस्थीसिया उसमें काम नहीं करता, लोकल एनेस्थीसिया काम नहीं करता, क्योंकि अगर आप लोकल एनेस्थीसिया इंजेक्ट करते हैं तो लोकल एनेस्थीसिया भी उस टाइम फिलिंग और स्वेलिंग कॉज करता है। So in most of the areas I prefer not using an anesthetic in a filler. Wide margin of safety. This is where your reputation stands. अगर you have used a filler जिसके बारे में आपने कहा है कि ये 6 to 12 months काम करेगा और वो 3 months में खत्म हो जाता है, that makes the patient question you. इसी तरह अगर वो फिलर माइग्रेट कर रहा है या वो एलर्जिक रिएक्शंस कॉज कर रहा है या उसमें और मसले आ रहे हैं, again you are the one to blame because patients do not know the companies. बहुत अच्छे जो patients होते हैं जिन्हें पता हो कि हम हाँ ये है, लेकिन अगर उन्हें पता भी है तो वो patients होंगे जो आपसे रेस्टिलीन या जुवेडर्म मांगेंगे और वो फिर इतने एक्सपेंसिव हैं कि उसके बारे में आप श्योरिटी दे सकते हैं because that is given by the company. Mostly बाकी जितने भी patients होते हैं they trust you for the filler. आपने product inject किया है. Now every product comes with उसके अंदर एक दो stickers होते हैं. So you should know कि आपने किस patient को कौन सा particular filler लगाया था, उस पर उसका नाम लिख लें, sticker लगा लें, so that you remember कि अगर कोई issue आता है after 3 months, 6 months, you should know कि आपके पास कौन सा filler था. Ideal filler should largely be undetectable once in place. अगर आपने filler किया और उसका पता लग रहा है, it's not just for filler, it's for every cosmetic procedure. If other people can see that this is something which is done, it means it was not done correctly. आपके सारे procedures ऐसे होने चाहिए कि उसका पता ना लगे. कल I was sent a video by one of our juniors in plastic surgery asking, वो video किसी ने अपने Instagram पे share की थी, an American surgeon, and he mentioned that before after of a facelift. तो वो पूछ रहे थे कि facelift में इतना ऐसा result आ सकता है या नहीं. And I looked at the video and I asked him, what do you think? Is it just facelift? So she said, नहीं. Could be others, but I don't know. The patient has had upper lid blepharoplasty, lower lid blepharoplasty, loss of weight, और उसके बाद facelift हुआ था, so it can give you very dramatical results. लेकिन ये सिर्फ Facebook, Instagram पे अच्छे लगते हैं. In real life, people do not want such obvious changes. आपको change इतना रखना चाहिए कि बस वो patient, he should look a refined version of himself. He should not look like somebody else. Then ideal filler should be of non-animal origin, easy to inject, easy to store, ease of learning how to inject. जितना अगर मुश्किल होगा सीखना, उतना वो knowledge भी spread नहीं होगी, वो filler भी utilize नहीं होगा. And it should have minimal side effects. Or biodegradable. This is something that saves you. If something goes wrong, biodegradable filler जो है body खुद ही उसे degrade कर देती है and you don't need to worry about it. Ideal filler should have a long duration and it should persist. Performance promise, चूँकि आप claim करेंगे अपने patient को कि this is going to look good and the patient is just giving you money because they want to look good. So you have to make it look that it performed well और वो promise वो patient आपके trust पे ही वो कर रहा है. So you should be sure about the filler, the product that you use. Cost should be reasonable, non-toxic, non-inflammatory और non-carcinogenic. ये वो चीजें हैं कि जो आप companies के profile और उनके literature देख के decide कर सकते हैं. अच्छा, अब filler is a word which is very widespread. इसलिए हमने उसकी काफी सारी classifications की हुई हैं. One classification is this, since it's a type of a graft, तो उसमें hetero graft taken from somebody else, allo, taken from this is taken from another species, this is from the same species, this is from the same person, and then there are some synthetic products. एक और क्लासिफिकेशन ये है कि फिलर बायोडिग्रेडेबल है या नहीं है या स्लो बायोडिग्रेडेबल है. For example, for silicone, it's very long lasting and it's non biodegradable. Most of the fillers that we use, they are either biodegradable or they are slowly biodegradable. Then we have this hyaluronic acid, जो एक ऐसा word है जो बहुत ज़्यादा आपसे, even when the patients are coming up, they keep on asking because everybody can search and they ask for this hyaluronic acid. तो इसमें आपके पास fillers भी आते हैं, इसमें कुछ आपके पास injections भी आते हैं that are used for skin rejuvenation. और इसके साथ इसमें majority of the fillers, जो भी Restylane का नाम मैंने लिया, Juvederm का लिया, ये सारे जो हैं, they are one form or another of hyaluronic acid. कुछ collagen fillers, ये भी एक टाइम में आए थे animal origin के, but they are used very rarely. अच्छा, कुछ long lasting fillers जो biodegradable हैं, उसमें for example you have the calcium hydroxyapatite fillers. ये अक्सर लोग they want to have a jawline contouring. For jawline, you can use hyaluronic acid in the beginning, but later on when you have perfected your technique, so the calcium hydroxyapatite, so this can give you a longer lasting result that goes up to 18 months to 2 years. Silicone, this is non-biodegradable. Shuru mein, since everywhere in the world people asked for very long lasting fillers, तो उसमें फिर सिलिकॉन का यूज हुआ था, but now it has completely vanished. Silicone is used in implants because उसकी अंदर either it is saline filled or it is silicone filled, लेकिन outer covering जो है वो silicone की होती है. The good thing about silicone is that it does not cause much of a reaction inside the body, but still it has its own complications as well. तो वो बड़े areas में आप use कर सकते हैं. For example, breast implants, उसमें silicone use हो रहा है. Implants anywhere else, cheeks में use कर रहे हैं लोग, chin में use कर रहे हैं. वहाँ पे silicone का use है, not in fillers. एक longevity, since it's such an important word, कि patients ये ज़रूर पूछते हैं कि ये filler कब तक रहेगा. So उसकी basis पे भी एक classification है. That means a temporary, semi-permanent, and permanent. अब temporary fillers जो हैं, they are the ones जो सबसे ज़्यादा यूज होते हैं, और यही commonest used fillers हैं all over the world. They are mostly non-permanent and they stay for less than 12 months. Disappear spontaneously. Adverse effects, they are temporary. अब ये वाली चीज जो है, ये भी अक्सर पेशेंट्स आपसे पूछते हैं कि अच्छा ठीक है, आप कह रहे हैं कि 6 महीने बाद ये खत्म होगा, तो 6 महीने बाद ये कैसे खत्म होगा? 6 महीने बाद I'll wake up in the morning और फिलर बिल्कुल ही खत्म हुआ होगा? ऐसा नहीं होता. Filler dissolves slowly. आहिस्ता आहिस्ता they would start feeling कि कम हो रहा है. पहले उन्हें filler, they'll be able to feel the filler. जब आप filler को palpate करेंगे, you are definitely palpating it against a strong hard surface. जैसे यहाँ पे maxilla है, नीचे teeth हैं. So if you have done a filler in the nasolabial और patient मुंह से palpate कर रहा है, the patient would be feeling it. After 6 months to 12 months के बीच में आहिस्ता वो feeling जो है वो कम होती जाएगी and the filler will dissolve. इसी तरह temporary में कुछ ये animal based जो fillers हैं, कुछ human tissue derived collagen है, इस पर भी काफी सारा काम हुआ है, human placenta और उससे बनाने के लिए. Some they have also been used in treatment of some burn patients, लेकिन they are not very much in. Synthetic fillers, hyaluronic acid based, they are going to be the mainstay of your clinical practice. अच्छा, semi-permanent जो है, they undergo slow degradation over a time of 1 to 2 years. जैसे मैंने आपको ये कैल्शियम हाइड्रोक्सी एपेटाइट के बारे में बताया, PMMA है, और ये they are the semi-permanent one for both that goes up to 2 years. Side effects are more common and longer lasting. क्योंकि आप उन fillers को ज़्यादा dissolve नहीं कर सकते, so you need to be very good when you're doing that. Permanent remain for longer than 2 years. Side effects tend to be more permanent, and complications is the main issue. जैसे मैंने आपको कहा, naturally your own fat after liposuction can be used, but वही मसला है उसमें कि if that thing goes wrong. I recently got a patient who had filler, fats for fat transfer for her face, और उसमें एक मसला ये हुआ था कि उसके यहाँ पे फैट बहुत ज़्यादा हो गया था. That made her nose look very wide. Since it, जब उन्होंने surgery की थी, that was in 2007-8. After 12-13 years, she read somewhere that you have fat dissolving injections, and then she came up and I started her on that treatment, telling her very clearly that it's such an old fat and I'm not sure ये injections कितना उसे help करेंगे. But now the fat has been reducing after 3 sessions. इसी तरह जो मैंने ये अभी कटरीना कैफ वाली मिसाल दी, if you have a patient like that and who continuously wants a longer lasting result, ये एक ऐसी चीज़ है कि जिससे आप अपने क्लिनिक में तंग हो जाएंगे. Everyone wants a long lasting result, लेकिन long lasting is never possible. वो इसलिए possible नहीं है क्योंकि हर दिन के साथ वो ज़्यादा बूढ़ा होता जा रहा है, हर दिन के साथ स्किन लैक्सिटी बढ़ती जा रही है, हर दिन के साथ कोलेजन कम हो रहा है, हर दिन के साथ फैट कम हो रहा है. कल हमने बात की थी that you are losing a teaspoon of fat every year, ठीक है? So bone भी loss हो रहा है, fat भी loss हो रहा है. So if you give something a permanent, for example, एक patient है जिसका आपने let's say the simplest filler nasolabial आपने लगाया, and somehow he wants to reduce his weight. अब वो फिलर जिस क्वांटिटी में आपने लगाया था, अगर वो 3 महीने में 10, 12, 14 किलो कम करके आता है, you would see that the same filler would look bad in here. So permanent is never a good option. उसमें whenever you're talking to a patients, tell them it's more harmful than beneficial. उसमें आप भी सेफ रहेंगे, उसमें पेशेंट भी सेफ रहेगा, क्योंकि वेट लूज करने पे वो बहुत ज्यादा खुश होगा, but he would come back to you and say that your filler has gone wrong और ये अब यहाँ पे बॉल नजर आ रहा है. And this is very common now. People are into bariatric surgeries और वो महीने के 15-15 किलो वजन कम करके आ रहा है. So they reduce all over the body. और फिर जहाँ पे आपने fillers किए हुए हैं वो फिर obvious हो जाएंगे. Now let's suppose you have done a filler that lasts for about 1 to 2 years. उसमें everything would go wrong. Jawline आपने बिल्कुल ठीक की होगी, but वहाँ पे फिर balls नजर आना शुरू हो जाएंगे. So it's always good to tell your patients कि आप मुझसे long lasting fillers ना मांगे. You go for the short acting ones so that if something goes wrong I can correct it. Even यहाँ पे based on longevity, permanent fillers, side effects tend to be more permanent and complications is the main issue. And so now there are some examples. 3 to 18 months with hyaluronic acid and collagen fillers. This is the ideal. It's good when you're starting your clinics, and it's also good, I would say, until 5 to 10 years that you have done your clinic. क्योंकि जितना भी आप अगर senior हो जाएं, going for these things, semi-permanent and permanent, they would always want you to be very extraordinary in your work. Or patients, they are not forgiving because aesthetic patients वो हैं कि जो they don't have a disease. अगर वो बीमार होते और आपने उन्हें treat किया होता, they'll be thankful. यहाँ पे they are paying you and they feel like it's their right, or it's rightly so their right, क्योंकि they're doing it because they know you or they have searched about you and they want good results. So इसलिए it's good to start off with and practice the temporary fillers. Permanent में silicone है, PMMA है और ये चीजें हैं, but their use is very low. अब एक और क्लासिफिकेशन इस बात पे है कि आप फिलर डाल कहाँ रहे हैं. कल हमने बड़ी डिटेल में स्किन की बात की थी.